you who do not know me, my name is Ashmita and I'm a counseling psychologist based in South Africa. I'm also currently walking the dementia journey with a loved one, and I've created the Dear Dementia YouTube channel to assist you, the caregiver, in your caregiving journey. So what I've started to notice is that one of the most common challenges faced by us caregivers, especially in the later stages of dementia, is to persuade our loved ones to take a bath. Yes, we know that personal hygiene is of utmost importance, especially in being able to prevent skin conditions, urinary tract infections, and other health-related ailments. But bath time is associated with hostility and screaming, agitation, and arguments. So when we're faced with such resistance, I think one of the most important things for us to do is to understand or to unpack the underlying reason for bath time refusal. If we look deeper, there's always a reason for the bath time refusal. Once the reason can be better understood, we are in a much better position to be able to implement the necessary changes to reduce frustration as well as fear. So what we'll be doing in this video is unpacking some of the common reasons for bath time refusal, as well as looking for some suggestions to make the bath time experience more pleasurable for both yourself as well as your loved one. So when we look at some of the reasons for bath time refusal, your loved one may be refusing bath time because they fear falling. This may be especially due to poor balance, to muscle weakness, or they might just be on sedative-type medication, which also leads to a feeling of lack of balance. They may also fear the rush of water from an overhead shower. This may be extremely threatening to somebody with dementia. There might be a feeling of a loss of independence, and this could result in frustration, agitation, and anger. So feeling like they can't groom themselves as they usually would, or they're not able to remember the steps for bathing. So the bathing process may just become too daunting for them as well. Or there may be feelings of embarrassment, feelings of vulnerability, being disrobed, being unclothed in front of other people. And there might also be an increased sensitivity to water pressure or temperature, and this is generally caused by the disease. So these are just some of the common reasons that your loved one may be refusing the bath time process. So what I would do is to look at certain suggestions to assist with this bath time process. So for instance, in the bath time process, I would offer the person choice. So for example, I would ask them, would you prefer to have a bath or would you prefer to have a shower? Would you like to shower now or would you like to shower in 15 minutes time? So choice allows the person to believe that they are in control, and this helps to reduce the feelings of frustration or the feelings of agitation, and will probably remove that resistance that we're facing. Then the second most important thing is to acknowledge the fear. Respect that bath time may be experienced as extremely uncomfortable and perhaps even threatening. So be patient and be calm in your approach. If the person resists, perhaps distract him or her with an activity or with something else to do for a few minutes, and then pose the idea of bath time again. Sometimes a simple distraction will assist you in redirecting them towards bath time. Once they are ready for a bath, make sure that the bath time is prepared in advance. So ensure that the bath area is safe and it is comfortable. So remembering that one of the reasons for bath time refusal may be a fear of falling, I would use non-slip floor mats to prevent falls. I would also perhaps use handrails or install handrails if I don't already have handrails. And make sure that the type of handrails that they can grip onto. I would also use a shower chair if necessary, if they're feeling like they may fall or there's a sense of lack of balance. I would remove all electric devices and sharp objects such as razors, making the environment even more safer for them. And then, just look at some ways in which we can make the experience more pleasurable. So, for instance, preparing towels and clothing in advance so that they're not standing out cold or uncomfortable after the shower or the bath. I would use warm cloths or washcloths to enhance their comfort. And I would perhaps even use a nice smelling bath time bubble bath, or I would use a nice smelling liquid soap. And I might even play relaxing music that they can hear while they're in the shower. So all of this will go in such a long way in helping them to feel like the bath time experience is more manageable. Then another suggestion would be to address issues of vulnerability and embarrassment. So try to maintain their dignity. You can do this by keeping the bath area as private as possible and away from the view of others. So consider a same-gender caregiver to assist with the bathing process if necessary. Then looking at the actual bathing process, another important thing to remember is to consider the shower head as well as the water pressure. So the spray of an overhead shower can be very terrifying for someone with dementia. This may be due to the increased sensitivity to water pressure caused by the disease, or the person may also not be able to simply see the water, and they may be experiencing the shower, especially with the water droplets on the head, as an overhead attack. So a handheld shower can help to reduce the fear because you are then able to direct the flow of water. Alternatively, you could just change the shower pressure to a much softer setting. It's also important to be able to adjust the water temperature as and when necessary. A person with dementia does not always able to sense the water pressure if it's too hot or if it's too cold. So monitor the temperature throughout the bathing process. Then another suggestion would be to encourage active participation. If physically able, invite the person with dementia to actively participate in the bathing process, allowing as much independence as possible. So offer them choice. Obviously not more than 2 choices as this may overwhelm them. But for example, give them the choice to say, do you want this shampoo or do you want that one? Do you want to wash your arms first or would you prefer to start with your belly? Allow them also to be in charge of something during the process. So ask them if they'd like to be in charge of holding the soap or holding the sponge. So by increasing their level of participation during the bath time process, you allow them to feel more confident and it helps them to maintain their sense of dignity and independence. Then one of the other suggestions would be to provide verbal guidance throughout the process. The number of steps taken to complete a bath may be experienced as very overwhelming or simply daunting for a person with dementia. So let them know in a step-by-step manner what is the next step in the bathing process. And this will help them to avoid uncertainty and to reduce anxiety. So for instance, you may tell them, next we are going to soap your legs, or next we are going to rinse your hair. So these are some of the general tips and suggestions that I would use for the bath time process. I hope that you found this video useful, and if you did, please subscribe to the Dear Dementia YouTube channel. I'll be posting similar videos to assist in the caregiving process. I wish you well on the caregiving journey. Thank you. Goodbye.